So the questions is, why does this occur? And I think the issue is implicit bias. And there's an implicit bias test that I would encourage you to take a look at it. And of the people, thousands of people have taken this test, and of these people, what they've shown is 88% of whites people are biased for whites, and 48% of blacks are biased for whites. And so when you have this implicit bias, meaning that you react to the bias is not an overt sort of preference. It is a hidden preference that is impacting your thinking without you even being consciously aware of it. So let's go back to this a minute. Let's take a few of these as examples and try to look at what the implicit bias is. So less likely to be referred with renal transplantation. Well, pretty much that one should be pretty easy. Part of the things, people have this idea that that since minorities donate less kidneys, there is no kidneys not available for them. But the fact is that type matching is across racial type, and so there's no reason not to refer minorities for kidney transplantation. The pain issue may be really pretty straightforward. When you have a black man in severe pain, the studies show that they get less potent medicine and less medicine. And what's the bias that may be in play? Stereotype that he's a drug abuser, that he's drug seeking, that he is seeking the medicine for reasons other than his own pain. And so a doctor with that bias might try to help this person by not giving them this medicine to sell or abuse. The amputation one, you have to kind of know a little bit about what's going on there to understand the bias that might come into play. So what you have is with diabetes, people's feet can be affected to the point that their tissues start to die, and they can develop gangrene. Gangrene can kill if not treated aggressively. And if it's established, if it starts, and in fact, oftentimes, if you have gangrene, all you can do is amputate. But in the stages right before it's developed to that point, you can do aggressive medical treatment. So what you have is people coming in with these bad foot problems that could be treated by aggressive medical treatment. But if they don't treat it by aggressive medical treatment, it definitely will develop into serious gangrene, and they could lose their life. So what's the stereotype? That blacks are non-compliant, that they're not going to follow through on treatment, they're not going to do what you tell them to do, and consequently, if you send someone with these kind of foot problems home, that they're more likely to wait around, let gangrene develop, and then you have a person who will die. And thus it's better to amputate than it is to allow this problem of non-compliance. So just wanted to show you first that racial discrimination in medical treatment is a serious problem, that it's not related to severity of illness and ability to pay, that it's based on race, and that it's based on implicit biases. I don't think that most people are intentionally or consciously discriminating based on race.